families, then we'll be able to stop the spread of this virus. And so that's really what this is all about today. This is about stopping the spread of the virus. Just prior to coming downstairs, I received a new executive order from our governor, and that executive order did a number of things. Governor Ron DeSantis issued Executive Order 20-71, directing all restaurants and food establishments within the state of Florida to suspend on-premises food and alcohol consumption for customers. The listed establishments may, however, operate their kitchens for the purpose of providing delivery or takeout services. In addition, the executive order lifts the restriction that prohibits a specially licensed food establishment from selling packaged sales of alcohol for delivery, takeout, or consumption off premises for restaurants complying with the executive order. Alcohol sales to go with food that is for pickup or delivery will be permitted, and ID will be required for orders including alcohol. These, of course, are related to Florida statutes under chapters 561, 500, and 509. This, again, also included the closures of gymnasiums and fitness centers within the state of Florida. Now, as I kind of transition to what we're doing here locally, I want to remind our community that we are all in this COVID-19 fight together, and we are relying together, not just within Orange County, but as a region, state, and a nation. We must be vigilant in protecting each other's health, even though there are restrictions on how we interact and socialize. The health of our community, particularly many older patients and those with underlying health conditions, is at stake. We need your help. We need your help, the public, to comply and cooperate with the directives that we are laying out today. As of today, we have 22 cases in Orange County involving COVID-19. That's up from the last time that we came before you by way of a press conference. It's up from the 14 or 15 just a couple of days ago. So the numbers are continuing to increase. Out of the 22, 19 of those individuals are really residents of Orange County. Some important points we want to highlight today include social distancing and continued safety. In other words, we are going to be enacting a curfew. We must continue to practice social distancing and be mindful of unnecessary trips and social interactions. If you are experiencing mild symptoms, isolate yourself at home for at least 14 days until symptoms are gone. And please save hospital beds for people at least 60 years old and those with chronic health conditions if possible. To help ensure these public safety measures and encourage social distancing, I am implementing a curfew for Orange County effective tonight at 11 p.m. through 5 a.m. until further notice. And that means that until the order expires from 11 p.m. to 5 a.m. Each night, there will be a curfew countywide here within Orange County, inclusive of the municipalities. Please be mindful of this curfew and only go out if you are required to do so for work. Other exemptions for the curfew include essential workers like medical personnel, government personnel, first responders, security personnel. The Orange County Sheriff's Office will be enforcing this curfew starting tonight and moving forward. Orange County's Convention Center parking lot is being made available to the Department of Health Emergency Management for the state of Florida to work with our state government to begin testing. We believe that it is likely going to begin the first of this coming week. We also will be opening a test site within East Orange County, again, Please be patient. Additional information will flow regarding the testing sites that will be opening the beginning of next week. One point we would like to stress to the public is that these testing sites are not a catch-all for everyone to be tested. You need to show specific signs, have underlying indicators where you have a compromised health immune system and other specific symptoms in order to be tested at these particular sites. We do not want the public to flood to these sites, especially if you are healthy individuals. In terms of hardships, we realize again that our community is experiencing various financial hardships. If you have a financial hardship, I'm going to announce that because of these hardships, we are offering a COVID-19 rental assistance program to help those who reside in Orange County and need help with rent and utilities in the coming month. We have established a crisis assistance hotline at area code 407-836-6500, 407-836-6500. The hours of operation will generally be during normal business hours, Monday through Friday, between 8:30 a.m. and as late as 3 p.m. Beginning likely this coming Monday, we will have that hotline up and available for citizens who need crisis assistance. In addition, I understand that people are emotionally impacted by this. We're asking our clergy and other members who are mental health professionals and in this community to step up to the plate and assist those who may have emotional, mental, or psychological stress or anxiety associated with this occurrence. I will remind those regarding the crisis assistance. This is a one-time benefit for 1 month's rent assistance for Orange County residents only. You must call for an appointment in order to drop by the necessary documents in order to qualify for the assistance. Then a phone call will be set up with a case manager to follow up with you. We want to keep, again, our social interactions to a minimum, which is why we are requiring that the documents be dropped off and that you follow the appointment schedules. Appointments will not be given to Orange County residents who are receiving payment from their employer or any other social service organization, such as the United Way. Due to the number of people in need, please understand that the call center line will be busy at various times, but we encourage you to continue calling. As it relates to Orange County government, our focus here in Orange County has always been to protect the well-being and health of everyone, and most certainly our hard-working employees who are the backbone to providing essential services to our community. With that being said, as of Monday, March 23rd, our staff will utilize alternative measures to continue operations and facilitate social distancing. What does that look like? It will look different for every department, as many of our critical county functions, such as public works, utilities, law enforcement, corrections, and fire rescue, have to continue to work at their normal work locations. But let me say this to our entire community. I'm asking those who can work remotely to do so from home. This will ensure that business continues to operate as seamless as possible. As for our essential employees that need to report on site, we will have staggered schedules and ask half of our staff, when possible, to telecommute. We understand that our residents and businesses rely on Orange County to provide critical services, and we will continue to do that in the environment that we find ourselves in today. Again, in times of stress, many times anxiety can overwhelm some of us, and that is understandable and normal. Let us be calm, informed, and measured in our proactive and planned response. I say to all of our Orange County residents, take care of yourself and your family, both physically and mentally. Information is power and arms you with reassurance you need for yourself, loved ones, and neighbors. We need your help to get through this crisis, and together we can get through it. At this time, I'm going to ask Mayor Dyer to come forward and offer comments as well. Mayor Dyer, the City of Orlando.
Thank you, Mayor Demings. Since Mayor Demings concluded with the update on Orange County operations, why don't I just tag right into that and talk about city operations. As of close of business today, all city facilities will be closed to the public. The vast majority of our employees that can work remotely are working remotely and have been most of this week. The vast majority of our services that citizens would generally come to City Hall for can be done electronically. 290 of our services are done that way. And then, of course, our critical services, police, fire, public works, will continue to operate. You know, it's been just a little over a week since our country and our community's been changed in unprecedented ways, and we have a lot of challenges that we've faced. It seems like they change, if not day to day, almost hour to hour. And the reality is we don't know how long this is going to last. We don't know what the impacts on our citizens and our neighborhoods are going to be. But what we do know that both individually and collectively, we can make a huge difference in the spread of this virus. We know that every single one of us can take actions that are going to turn the tide. And Mayor Demings stressed social distancing. Now's the time to do it. A lot of people have taken it lightly in terms of heeding that call. And I know that it can be inconvenient in the short time, but it's going to make a huge difference in the long term. It's going to make a difference in the impact to you. It's going to make a difference in the impact to your children, your family members, your neighbors, and everybody in Central Florida. So each of us has to commit to doing this. It can't just be some of us. We have to encourage others to do the same. It's not going to work if everybody's not going to be on board, and that's especially our young people that are asymptomatic and think that they are strong. They need to heed the call as well. So we have to confront this health crisis together by staying apart from one another. I know that sounds kind of weird, but we can be together by staying apart from each other. I want to salute all those in our community who are on the front lines. I've had a number of conversations with Advent Health and Orlando Health, and they are ready. All of our healthcare workers, our first responders who are working to keep everybody safe and healthy, making sure that we have our food and supply lines available, our schools and our teachers that are having to change the entire way that they teach going forward. In the days and weeks ahead, we need to encourage these heroes. We also have residents and families and neighbors and local businesses, and especially our service and hospitality interests that are already experiencing significant financial strain. And as a community, we need to come together and exhaust every possible idea that we have to help them to ensure that the financial hardships they're enduring don't last long and we get them back on their feet. So I applaud the county mayor for setting up the Crisis Assistance Program, and certainly Heart of Florida United Way, Second Harvest Food Bank. Residents who've lost employment should apply for reemployment assistance benefits through the Florida Department of Economic Opportunity. The state has activated the Florida Small Business Emergency Bridge Loan Program, and the SBA has opened its economic injury disaster loans. Both support small businesses that are being impacted. So the next few weeks and probably the next few months are not going to be easy for our community, but like we've done before in the wake of Pulse, in the wake of hurricanes, we're one Orlando united, and we'll get through this together. Dr. Pino.
Thank you, Mayor. Good afternoon. During my conversation with our health providers in the county, they have to ask, and is stay home. Our providers need the services, need the infrastructure to be ready to provide care for those who need it the most. And the ER is not the place to get tested for COVID-19. If you are afraid of infections, if you are afraid of getting sick, an ER is not the place that you will go to. That's the least that you want. We want to reserve that place for those who are in life-threatening situations. And our providers, our firefighters, our EMS, our service personnel, and the 525 employees of the State Health Department are at work. And the only thing that we ask the community is to stay home so that we can go home soon too. With that, I would like to give you the latest reports that we have for today. As the Mayor Demings mentioned to you, we have 22 cases in the county, 18 are residents of the county, 4 are not. That's the total number. The cases that we have been reported today are a 31-year-old male who remains at home in self-isolation. We believe that he was exposed to a coworker. More investigation is needed. Everything that I'm saying today is preliminary as we continue to do our EPI investigation. We also have reported today an 84-year-old male who came from New York City and has been hospitalized, but is in stable conditions. We also have a 50-year-old female. The exposure is unknown, and it is stable, hospitalized but not intubated. And we have a visitor from Latin America that has been hospitalized, 39 years old. Is not a resident of the county, but is currently here. And that person is also hospitalized, intubated, and in guarded condition. Thank you. Oh, I always forget to introduce Yolanda Martinez, my good friend and co-worker from the Department of Health Services for Orange County.
Good afternoon. Thank you, Dr. Pino. I know that the information that we provide seems repetitive, but that only means that we're all on the same page, that all the people working for the residents of the county are of one mind, and that mind is that we want to keep everybody safe. We want to keep everybody home, like Sheriff Demings and Sheriff Dyer. Sheriff Demings, Mayor Demings and Mayor Dyer and Dr. Pino have mentioned. Social distancing, hand washing, covering your cough, and staying home when you're sick. Those are all vital. They're more so important for individuals that have compromised immune systems. There are also elderly, individuals with underlying medical conditions like high blood pressure, cancer, or under cancer treatment, or cardiovascular diseases. It is very important that this individual stay home, and it is very important that those of us who are experiencing symptoms of cold or flu stay away from them. As much as we might love them, we love them more if we stay away from them until we recuperate. We also wanted to reiterate that we're working with our partner hospitals, as Dr. Pino and Mayor Demings mentioned, to make sure that we are able to provide to them the assistance that they need to get the reagents and other testing supplies that they are needing in the hospitals. They're doing their efforts, obviously, but we're offering our assistance as much as we can. As Dr. Pino mentioned, if you're exposed, please do not, or feel that you have been exposed, please do not just show up to the emergency room and to the hospitals. Look at what has happened in some of the countries in Europe and in other areas with individuals that have overwhelmed the hospital system and the emergency system. And finally, I just wanted to mention about the drive-through testing that will take place on Monday. We have been informed that individuals that will be tested are those that are 65 years of age or older and that might have symptoms or underlying health conditions, medical personnel, and first responders. Those are the key individuals that will be the focus of the drive-through testing on Monday. So if you're over 65 and experiencing some symptoms or have underlying health problems, medical personnel that might be experiencing symptoms, or first responders, again, that might be experiencing symptoms. Those are the key individuals that will be the focus of the testing on Monday, that will open hopefully on Monday, the drive-through testing. And with that, it's my honor to pass it over to Orange County Sheriff John Mina.
Thank you, and good afternoon. So for your safety, the safety of our deputies and other personnel, we want you to encourage all residents and visitors to closely monitor all the coronavirus developments coming from our local, state, and federal officials. So we are working to help stop the spread of this virus and save lives. And as the mayor mentioned, the curfew will start from 11 p.m. tonight and end at 5 a.m. Every morning until that order is rescinded. And again, there will be exceptions for healthcare providers, law enforcement, first responders, those who have an essential need to be out and about, those coming to and from work, of course, will be exempt. We want people to stay home. We want people to adhere to the orders, much like we do in the hurricanes. We're not looking to arrest people, but we want people, for their safety, for the safety of this community, to remain at home. Additionally, the west lobby of our central operations building will be accessible by appointment only. We're going to close those front doors to the public. We, of course, are going to maintain our registering of sex offenders. And we also want to remind you that you can report many crimes online. Go to ocso.com. And I want to mention that the Orange County Sheriff's Office, along with the rest of Central Florida law enforcement, is working hard to continue the job that they do every single day, and that is keep this community safe, in addition to enforcing this curfew, in addition to providing security for food distribution sites. And today we met with state officials and National Guard to go over the logistics of the testing site at the convention center. So that's well underway. We'll be working with them to provide security and traffic positions out there well. And so finally, just also want to commend all of our first responders, all of our healthcare providers, and especially our law enforcement officers who are out there every single day. By the nature of their profession, they're able to adapt to change and overcome many, many challenges. So we're asking our community to do the same. We'll all get through this together. With that, I'll turn it back over to Mayor Demings.
Okay, at this time, we'll open it up for any questions that you may have relative to anything that was discussed today.
Given the lack of testing that's going on in our area and across the state, who should be accountable for this? And what are your thoughts on the fact that here we are still on Friday, we don't have a mass testing set up like we expected, and people feel like they truly need to be tested who have not been tested?
Regarding the lack of testing here within our community, obviously we're all frustrated about that, but we have been working very closely with the state and the federal government. We do now have some supplies here within the state now, and they're being distributed. So we know that by the beginning of the week, we'll be able to begin the testing. And the only thing I can say, it is what it is. Until we can get to the testing that is necessary, it is difficult to be able to have the type of public health response that is needed.
Back on that, do you have any idea what the turnaround time is going to be on those tests that are taking locally?
Well, depending upon the various reagents that could be used, whether that's in the private sector or those that will be used by the state deployment, the time period differs from anywhere from a few hours to it could take several days. So depending upon the reagents that arrive here within the community, that will be the determining factor. But suffice it to say, what we're all working to do is to ensure that the testing begins as quickly as we can possibly begin that. And desirably, we want the results to be in as quickly as we can get them as well. Primarily, we want to be able to give ample notice to individuals that the curfew will be in place starting tonight. Secondly, we believe that for the most part, any legitimate businesses that are operating will have concluded their work by that day, and we're able to get those workers who are still going to work home if they're not essential, critical first responders, healthcare workers, physicians, etc. We'll be able to get those individuals back and forward. And so that is why we selected the hours. That was done in consultation with the sheriffs, local law enforcement, and even with our surrounding counties as well.
Have we seen any cases, positive cases within county employees, especially EMS or sheriff's office?
I am not aware of any specific Orange County employees who have tested positive for the virus. We have several employees who have traveled internationally, and they are in self-isolation at this time. With an abundance of caution, we are moving to this telecommuting to ensure that as people move about the community, that we don't inadvertently impact ourselves in a negative way.
Dr. Pino, kind of talk to us about the manpower that's going to be required once the testing begins.
I believe that was for Dr. Pino?
Yes, yes, yes.
I'm sorry, I didn't hear you.
Sure. Kind of talk to us about the manpower that will be necessary to run the tests once the testing facilities are open. What happens in the event that the medical personnel get overrun? Are there reinforcements in place? What do you guys have in place for that?
So on testing, a few things.
Could you repeat the question?
The question that you... Can you repeat?
Oh, sure, no problem. Okay, so what happens, what is in place for manpower, for staff, medical staff, for testing when they get overpowered or when the testing facilities are overrun?
So on testing, a few things. To add to what Mayor Demings said to the prior question, everyone who need to be tested has been tested, and we have the capacity to test anyone who meet the criteria that the CDC has set up. What we don't have capacity to do yet is massive testing. And part of the issue with that is that you don't want to start that until you have the chain of distribution in place so that you can run smoothly the operation. Because it will be very disruptive to do 50 and say, okay, I don't have test case for another 3 days, or to compromise and risk for those who need it the most, who are the people who are highly suspected to be positive. So those individuals are getting tested, and that's why we are getting positive. Now, other institutions have open tested to a broader spectrum of individuals, and they can do that. And private doctors, if they choose to, can collect the samples and send it to private labs. LabQuest, Quest Lab and LabCorp are doing testing for private providers. So that's important to make that differentiation. That's why we are selling call your primary care provider first before you go to the ER. With regard to your question, on the piece that I have control over, which is the testing site that we have established at Lafayette Trail area, we have 3 layers of providers and systems to have in place in case that any of those fail, in case that we get overwhelmed, or in case that our people need to be replaced. So right now, the first layer is ready, trained on PPE use, sample collection, and what the procedures are. And then we are training 2 other layers to be able to respond in case that we have any of those conditions.
Question for the sheriff. If you can just kind of follow up what the mayor said, just with the curfew, just how essential is this, and just talk about the enforcement process.
Yeah, so again, the mayor consulted with us, local law enforcement, and we all think this is needed. Look, we have to spread this virus. We have to save lives, and this is one of the ways we can do that. And that's why we're enacting this curfew from 11 o'clock every night until 5 a.m. in the morning. We only want those essential personnel who need to be out and about out there, and we don't want anyone to violate the curfew. We're not looking to arrest people, but we are looking to save lives in this community and spread the stop of the virus.
We've seen some instances of jails being, with the populations being released, at least to some extent, of reduce the populations there. Is there any talk of that right now at the Orange County Jail as far as reducing the
So I have talked with our corrections chief. They have plenty of room in their jails. I know that he's in consultation with the state attorney's office and the chief judge, and they're discussing that right now. But as far as capacity in our jail, we're at very, very low capacity. So right now we're good.
We've seen several states go to kind of a shelter-in-place type of order. Have you heard anything out of the state of getting something like that to happen here in the next few days, few weeks?
I have not heard anything from the state or the federal government at this point about any type of orders to shelter in place. But if the numbers continue to increase, we likely will end up at that point. We're not there today. If we work together and heed some of the directives that have been given at this point, we hope to avoid that. But if that becomes necessary, that is something that we all may have to do.
Mayor Demings, do you know if you have coordination with the other counties like Sumter, Lake, Marion, Volusia? I mean, are they on the same page?
There have been conversations statewide about various things, but primarily within our metropolitan statistical area. We've kind of focused on that area at this point. And those counties you mentioned kind of lie outside of our current employment centers. But again, in order to standardize this is where the state government comes into play. And so the governor issued recently an order that I talked about that establishes some of that consistency throughout the state of Florida. Okay, and there was a question over here.
Have you been notified of a young man who was here in town for a convention, went to Disney, went to Universal, went back to California, and just passed away yesterday? And if so, what is being done to backtrack where he was? Are you in talks with the theme parks about that?
The identities of individuals, from my perspective, are in most cases confidential because of various HIPAA laws. But I'm going to ask at this time Dr. Pino to come forward, and he may be able to share more specific detail about that. Dr. Pino?
So in any case, when we have the ability to, of course, with this person, unfortunately deceased, it's going to be a little bit more difficult if we don't have that information. But what we do is what we call trace investigation. So we contact individuals that we think were close contact with that person and provide, testing and other questioning. In the case of the theme parks, because it's an open space, it's more difficult. But with the airline and who was closer to him, we will be able to do that in the near future if it's not happening right now.
So that in that specific case, anybody that are in assisted living or nursing homes that tested positive for virus?
No, at this point.
Doctor, in that specific case, is that happening here in the community?
So the case is a case from California. They will initiate the trace investigation because it's the jurisdiction, and then we will collaborate with them if we have to investigate anyone in this county.
Do you know how many people, how many
That
patients
once
are still?
a person dies, HIPAA is no longer intact. I mean, isn't there more information that would come out about this person because they've died?
Yeah, it could be more information, but the California laws will be the one that apply in that case.
Of the patients, the cases that we've had in Orange County, do we know how many of those people are currently still in the hospital?
I don't have it in my, but we have the ability to know who is in the hospital. Yes, of the last 4 that I mentioned, 3 are hospitalized.
Dr. Pino.
Just going off of what we mentioned before, with a lot of the theme parks and other attractions already closed, do you expect, or are you seeing more large-scale hotels in the county expecting to close?
Well, this evening there are several large hotels that are slated to close, which again is part of the reason why we're enacting the curfew. Not only now will hotels, for the most part, many of them be closed, but our theme parks, the resort areas will be closed, and by order of the governor, gyms and fitness facilities and a number of other businesses, quite frankly,
Las calles debería estar, pero se reserva el derecho para las personas que trabajan en salud, las personas que trabajan los policías y los servicios de emergencia. Gracias.